Good afternoon, everybody. Good evening. Welcome to Congresswoman Sherrill's first town hall of 2021 and the first town hall of the 117th Congress for her. This town hall is focused on vaccine distribution. My name is Jill Hirsch, and I am one of the Congresswoman's district directors, along with Kelly Doucette, who is also on the line. While we're waiting for everyone to get logged in, I'm going to quickly run through some of our housekeeping information for the call. We will begin this town hall with some opening remarks from the Congresswoman, after which we will open up the line for questions. We've had hundreds and hundreds of pre-submitted questions, so we will have each of our guests start with one of those questions. If you would like to ask a question, please press *3 on your phone at any time, and you will be connected with one of our staff members and then put in the queue to ask your question live. When you are given the opportunity to ask your question live, Kelly will call on you. Please try to keep the question as brief as possible so that we can get to as many questions in the time that we have together. If we do not get to your question today, you can email it to the Congresswoman by going to sherrill.house.gov/contact. As always, we ask for your understanding. We wish we could all be together in the town hall, but given the current circumstances and social distancing requirements, and in order to keep everyone safe, we're having to tell a town hall this way. We've gotten pretty good at it, but if there are any lags or people talking over each other, please bear with us. And without further delay, I will pass this over to Congresswoman Sherrill. Congresswoman?
Thanks so much, Jill, and hi, everyone. This is Congresswoman Mikie Sherrill. I appreciate you all joining us tonight for our COVID-19 telephone town hall. This is the first town hall of 2021. We've heard from so many of you over the last few weeks with questions and concerns about the COVID-19 vaccine. So I wanted our town hall tonight to be focused on the vaccine and New Jersey's distribution plans. I know there's been some confusion, so we want to get you the best information. And I have some experts here with me tonight to help do that. I can tell you in my own family, it's been tough. My husband spent hours on the computer and the phone this weekend trying to get an appointment for my mother-in-law in California, and that won't happen until March. My mom's appointment. She was supposed to have an appointment in Virginia last week. That was just canceled the day before she was supposed to go. So it's been confusing. I share your concerns. I'm worried about my mom and my mother-in-law, and I know that we're so close to getting everyone taken care of. So we're in a little bit of confusion, but the good news is that the Biden administration is working hard to get more vaccines out to people. They've been working on their plan for months now, and I want to let you know that my team and I have seen a stark difference in transparency and access to information in this new administration. Operation Warp Speed would often not give us the information we sought, but the fact that the Biden administration is buying more vaccine, that New Jersey is getting more vaccine for the next 3 weeks, and New Jersey just received more federal funding from FEMA to help with distribution, these are all really good signs. I also want to say that as we get this good news, we do need to remember the vaccine process will take months. It's not going to be a process that happens overnight. It is going to require patience from all of us, as the number of appointments for vaccines can be limited by factors like the number of doses received each week by the state and the number of frontline workers available to administer the shots. But I hope tonight's town hall will help explain where we are and where we hope to be and provide some level of comfort that we should be doing better and better over in the coming months. We've been fortunate to have had incredible experts and leaders from New Jersey join our town halls, and tonight is really no exception. So joining me tonight, we have Dr. Jason Kessler, an infectious disease specialist at Atlantic Health System, who joined me on my first COVID town hall. Dr. Eddy Bresnitz, who's the medical advisor to the New Jersey Department of Health on the COVID-19 response. And Lordo is the Essex County Health Officer. She's been instrumental in helping Essex County respond to the public health crisis and in setting up testing and vaccination sites throughout Essex County. So with that, I'd like to get your questions. We've had 700 questions submitted for tonight's town hall. So I'm going to start by asking each of our guests one of the pre-submitted questions. And if you have questions of your own, please dial *3 on your keypad at any time to be connected with someone on my staff, and you'll be placed in the queue to ask your question live. So Dr. Kessler, we'll start with you, and thank you so much for joining me again tonight. We have Joanne from Cedar Grove who asks, I have a very good immune system. I've never gotten the flu shot, pneumonia, etc. And I'm afraid that if I get the COVID vaccine, it may mess up my immune system. I'm 67 and healthy and still work and keep active. I wear a mask and constantly wash my hands. So my question is, since I have a good immune system, why should I get the vaccine? Dr. Kessler?
Thanks, Congresswoman. And first, let me thank you for the invitation to participate and speak directly to the constituents in your district about the COVID-19 and the vaccine. So my response to that question is that I think there are two main reasons why everyone should consider getting the vaccine, or at least strongly consider it. I think the first and most important one is I think most people want to do whatever they can to protect themselves and keep themselves healthy. And they also want to do whatever they can to keep their loved ones who are around them, live with them, and colleagues who may work with them healthy as well. And I think that the vaccine is one of the best tools that we have in the present moment to do that. Secondly, I think most people want to see this pandemic come to an end. We want to get back to some sort of a life that we knew prior to January or February 2020. And again, the vaccine is one of the most critical tools that we have to help us along that journey. We know that COVID-19 is a very serious issue. While the vast majority of people who are infected will recover and do well, we know that a fairly significant portion of people have very serious problems once they get infected. More than 400,000 Americans have died of this disease over the last 10 months. Even a larger number of people have had lingering, if not chronic, infections related to their disease. Can you imagine, and I'm sure many on this call can imagine this, what it would be like to lose a loved one or to have a loved one suffer continuing symptoms related to COVID-19. And I think this is the primary reason why it's so important to consider getting the vaccine. We also know through the studies that have been done and through our experience already with using the vaccine that it is a safe vaccine. There are potential reactions that people can have, but it is much more likely for you to be struck by lightning than it is for you to develop a very serious, life-threatening reaction to one of the vaccines that has been approved for emergency use for the prevention of COVID-19. So for those reasons, I think anyone who is a candidate for vaccination should very strongly consider accepting it and getting vaccinated as soon as you are able.
Thanks so much, Dr. Kessler. And just, I know it's just one person, but my father, who's 76, was in the Pfizer trial, and he was disappointed because he thought he had the placebo, and he didn't feel any effects. He had no negative side effects, but they called him up last week to say that no, he'd actually received 2 doses of the actual vaccine. So we are hearing great stories from people who have gotten it so far, and I hope we continue to hear that. We next have Dr. Bresnitz. Thank you for being here as well to give us the state perspective. We've received a lot of questions about the timeline for residents who are currently eligible for a vaccine shot. Provide an update on what residents should expect.
Yeah, sure, Congresswoman. Thank you very much for having me on today's town hall. Really appreciate being here. So to give some perspective, currently we have over 4 million people who are eligible to get the vaccine based on the governor's announcement about who might be eligible. We have folks in the 1A category, phase 1A, which are healthcare workers and residents and staff in long-term care facilities, and also residents and staff of congregate settings. We have in the 1B area, we have law enforcement, sworn law enforcement and fire personnel. And then we have folks who are over 65, whatever their underlying conditions are, their health is. And then we have those who are 16 to 64 who have potentially a long list of medical conditions. So when you add it all up, you've got over 4 million people who are eligible right now, and there are more who aren't quite eligible who will be in the future. And so that's on the potentially on the demand side. On the supply side, as you mentioned in your introductory remarks, We are limited right now in terms of how much vaccine is available in the country and certainly in New Jersey. Up until this week, we were receiving a little over 100,000 doses a week, and that was to basically vaccinate people with 2 doses, because the currently authorized vaccines are 2-dose vaccines, although we're expecting in the not too distant future to have potentially a vaccine that only requires 1 dose. And so clearly with 4 million people on the demand side and only now it's about 130,000 doses a week with President Biden's release of more vaccine, we can do a little bit better, but it's going to take us a long time to basically meet the demand that's out there. Now, the demand, not all those 4 million people are necessarily going to want vaccine. There are those who clearly want it right away. There are a large segment of the population that is hesitant. Early on, when the surveys that were done showed that maybe up to 30 or 40% of the population was hesitant about getting any one of the vaccines. And then there are people who under no circumstances want to get the vaccine. But as the data came out on the currently authorized vaccines, people understood the safety profile and the amazing efficacy of 95% for both vaccines. There have been a lot more people who actually want to get it. The other factor that basically impact on what the timeline might be is the rate of vaccination. And so what goes into that? Well, it's a number of points of dispensing or pods, number of sites that can vaccinate. And there are many different types of sites. We have federally qualified health centers. We have mega sites. We have physician practices that are starting to come on board. We have pharmacies. It's the size of these sites and their capacity to vaccinate on a daily basis, and also the staffing as well. And of course, that impacts capacity is impacted by staffing and how many days a week that they're going to operate. So it's a complicated story. It's going to take months, many months, before we get to the point where we have community protection, or what people colloquially call it herd immunity. I like the term community protection as opposed to herd immunity. It's going to be a while, probably not before the summer or early fall before we reach that level of community protection. But I think that with the increased production from the manufacturers, the current manufacturers, and the ones that are going to come on board, we'll be getting increasingly over the next few weeks and months more vaccine to make available to the public.
Well, thanks so much, and I'll give a little bit of color on the federal side in a few minutes. And then Maya, thanks for all of the work you do for our community. You've been at this for a long time now. James from Livingston asked, I have registered with the state. Should I register with the county as well? I'm Group 1C.
Good evening, Congresswoman. So yes, if you're a resident of Livingston, those are 2 separate systems right now currently. So if you go ahead and register at the Essex COVID.org website, that is going to direct you based on your address in Livingston to our Sears site in Livingston. So yes, go ahead and register on the county Essex COVID.org website. They are separate from the state one.
Thanks so much. As I'm sure our panelists can tell, we really do have such a talented panel tonight. So I'm going to get to the questions, the more questions as they're coming in. I'm going to turn things over to Kelly Doucette, my other district director, so we can start taking your calls. Remember, if you have questions, you can dial *3 on your keypad at any time to be connected with someone on my staff, and you'll be placed in the queue to ask your question live. So Kelly?
Great, thank you, Congresswoman. Our first question comes as a pre-submitted question. It comes from Sarah in Chatham. Lack of supply of vaccine seems to be a major problem. Can the administration increase the supply, and how can they accomplish that?
Sarah, that is the number one question I'm getting lately, not just from our community members, but from our counties and our healthcare providers. So yes, the Biden administration has been working for months to come up with plans to increase the supply of the vaccine. And this is something that they are laser focused on. They're using what they call a whole of government approach. First of all, we're putting the word out. There are extra doses in some of the vials. The Biden team is working to ensure that each provider has access to the correct needles, so that these are low dead space needles that they need, so they can access those extra doses. And I was just speaking to Zufall this morning, and out of 9 vials, 6 of their vials contained extra doses. So that information is being promulgated. And I know I was on a healthcare provider call this morning. They're all well aware and working to make sure they have those extra doses going out. President Biden also announced on Tuesday that the U.S. is buying 200 million more doses of coronavirus vaccines. These extra doses should be available by this summer. So that is a 50% increase in the existing order. The U.S. has distributed somewhere around 48 million doses so far, so we now have 600 million doses on order. Biden's also said that the additional vaccine supply will be enough to vaccinate 300 million Americans by the end of the summer and the beginning of the fall. And Pfizer and Moderna have both committed to working to increase production. One of the major complaints, and this I think is being felt by a lot of our community members as they go to try to get appointments and understand the system, has been the lack of transparency. So I'll tell you, just, one of the big complaints that I was hearing from our counties and healthcare providers is I have no idea how many doses I'm going to have next week. So the way the system was working was that providers in the county would be told on a Tuesday how many doses they were getting, and they would have to come up with a plan to use 75% of the doses by the end of the week. And before that, they really couldn't plan for the week. But now the Biden administration has already told New Jersey that we will be receiving 130,000 doses per week for the next 3 weeks. So this should really help with some of the planning and alleviate some of the uncertainty. And finally, all of the planning that I've just been talking about only is taking into account the Moderna and Pfizer vaccines, which are already out for emergency use. We're hoping in a couple weeks to have an emergency use authorization for the Johnson & Johnson vaccine. That only requires 1 dose, so we should be able to utilize that to get more people vaccinated. And then I'm hearing that maybe by the end of the spring or sometime during the spring, we'll have the AstraZeneca vaccine ready for emergency use. So that'll also add to the supply. So while it's going to require some patience as the system adjusts to understanding how many vaccine doses we're getting each week so we can put that out better and get the appointment schedules better, I will say that we should see a lot of this alleviated as we go through the next several weeks as we start to see more and more vaccine coming in.
Great, thank you. And we're going to go to a live question now. This is a question from Andy, who is wondering about vaccine efficacy regarding the different strains of the virus. Andy, you're live on the line to ask your question.
Hi, Congresswoman, and thank you for doing this, and thank you for assembling this talented panel that you've got here.
Well, thanks, Andy.
I keep hearing on the news that there are these new strains of virus. They're deadlier, they're more contagious, et cetera, et cetera. You've just rattled off a number of different vaccines. There's Pfizer, Moderna, AstraZeneca, Johnson & Johnson, who knows how many more. Which of those vaccines and how effective are the vaccines against all these new strains of COVID?
Thanks so much. That's a great question. Dr. Kessler, can you start us off with that one?
Sure. I think it's a question that's on a lot of people's minds. It's been getting a lot of attention in the news, as Andy points out. I think we're going to learn a lot more about this question and the answers to it in the coming days, weeks, and months. So what I say now, I'm prefacing with, we don't have all the answers, and we don't have all the information that we need. However, I think preliminarily what we can say is that there are different variants of the virus that causes COVID-19. SARS-CoV-2 is the scientific name for it. And this is a natural process that occurs in viruses as they infect their hosts, that they can change, their genetic makeup can change, they undergo mutations, which is a natural process. And we're seeing the same thing in COVID-19. Some of these mutant strains or some of these mutants or mutations have resulted in virus that appears to be more infectious. We haven't yet proven, or it hasn't yet been proven, that any of these strains are more virulent or more dangerous than any other strains, but there does seem to be evidence that maybe some are more transmissible than others. And there's some preliminary evidence in the laboratory that some of these strains may not be as susceptible to the immune reaction or immune response that's engendered or engendered by the vaccines as it is against the wild strain of COVID-19, the first strain of COVID-19. But again, I think what we can say right now is there's no definitive evidence that any of the strains will be resistant to the vaccine at this point, and we need to keep, our eyes and ears open, and the scientific community is working very hard on establishing what the impact of some other strains that are circulating both around the world and in the United States, and what their impact might be on vaccine efficacy and vaccine safety. So even this afternoon, there have been reports that another vaccine, not some of the ones that would have already been mentioned, but another vaccine produced by a company called Novavax may be less responsive to one of the South African variants of COVID-19, at least preliminarily in their early phase trials. And so we need to continue to keep a very close eye on this. And I know the vaccine manufacturers are very much in tune with this, and they are continue to work on improving the vaccines that have already just been granted emergency approval. So I know that Moderna has already announced that they're working on trying to develop new vaccines. I'm sure similar efforts are underway at Pfizer, Johnson & Johnson, and the other vaccine manufacturers.
Great, thanks so much. Dr. Bresnitz or Mikie, did either of you have anything to add?
No, I think that's perfect.
Yeah, the only thing I would add is that right now we have only two vaccines that are authorized for use. They're the Pfizer vaccine and the Moderna vaccine. And the efficacy of both vaccines is fantastic. They're both about 95% overall, and even 95% in subgroups, race and ethnicity, gender, people with underlying chronic conditions. So, the message to the public is, yes, we should be concerned about these novel strains, but right now we have two vaccines that work fantastically against the current major circulating strain, and will probably work well against even the variant strains going forward. There is some, as pointed out, that there may be some less, ability to attack the virus from the current vaccines by the antibodies. But right now, it's probably more theoretical than in reality. The only other point to make is that the other vaccines that are in development, we don't really have the efficacy of those vaccines yet from the clinical trials. We're waiting for that. You mentioned the J&J vaccine. We're hoping to see the data within a week or two, and then they have to submit the file to the FDA for review and potential authorization. And the other vaccines, AstraZeneca and the Novavax one, also we'll have to see what the efficacy is. It may not be as good as the current vaccines, but we'll have to see. And as far as how they work against the strains, that's something for the future.
Thanks so much.
Great. Our next question comes from Steve from Oak Ridge in Jefferson with a question about a second shot. Steve, you're live on the line.
Okay, thank you, Congresswoman. Hey, my wife and I got our first shot, and we are scheduled on the 14th of February to get the second shot. With the concerns about the supply, will there be a second shot for us on the 14th?
Oh, so you'll have a nice Valentine's second shot. Thanks for the question. I'm going to turn that over to Dr. Bresnitz, and then Maya, if you want to chime in as well.
Well, the short answer is yes. There should be a second shot available to you. We have sent out directives to all the pods, the points of dispensing around the state, advising them that when they vaccinate individuals with their first dose, that before those individuals leave the facility, they should basically have their second appointment. Now, in some cases, they may say, we're going to send you an email or a text message or communicate with you within a short time period, 24 hours, that what your appointment might be. But if they don't do that, then individuals should call back to the site where they were vaccinated and find out when their second dose might happen. Now, there have been people who have left the facility and have tried to get contact with those facilities about scheduling their second dose and have had some difficulty. They should also call we have a call center that was started up in the state actually the beginning of this week. The number is 855-568-0545. And the agents on the call can help people to schedule their second shot if they don't have that appointment. Scheduling their first shot is a different matter. That's going to be something for the future when we get more supply. But there are different ways of basically ensuring that you get that second shot. But the main one is don't leave the facility until you have that schedule. In your case, you're going to have to sort of call back to that facility or call the call center.
Can you repeat that number
Sure.
that you have to call if you have any problems?
1-855-568-0545.
And if people do have the second vaccine appointment, can they be assured that there's going to be a supply there for them to get the second vaccine? Is there a chance that the state will run out before that?
No, I don't think so. And I would say they can be assured because when we get the shipments from the federal government, they are basically designating which ones are for first doses and which ones are for second doses. We provide data to the federal government through basically the vaccination sites provide that data through us, and we send it to the federal government through an application. And the federal government knows how many first doses were given out and from where, and then they provide that to us in a timely fashion.
Great. And then Maya, did you have anything to add to that?
I just want to say we did receive, same as the state. We do have communications with them, and we are assured that second allocation that second shot allocation is designated. We've received our second dose already, so we plan on continuing that with them, and we've also been assured and with all of our conversations that is going to occur in the second shot, and agreed also to ensure that if you are going to go ahead and get your first dose, just ensure that you have the availability or getting the contact information for that second shot in the same location.
Thanks so much.
And I should add that. Occasionally, somebody could have a second shot scheduled, and something comes up that day. They might get sick with something else, or some other emergency comes up and they can't make it, and they should contact the site to reschedule that appointment.
Great, thank you. Okay, Kelly.
Yeah, and we actually, along this theme, have another question about second shots. This is from Jerry in Woodland Park. Jerry, you're live on the line.
Yes, I was wondering, I've already had the Moderna shot, first shot. My wife and I are in our 80s. If we were not able to get the Moderna shot the next time, could we in fact get the Pfizer shot?
Thank you for your question. Dr. Kessler, do you want to take that one?
Sure. I think it's recommended that anyone who receives one particular vaccine should follow up with the second shot of the same type. So if you got Pfizer as dose number 1, you should get Pfizer as dose number 2, and similarly, same for Moderna. If you got Moderna, then get Moderna again. There may be, at some point, issues where that's not possible, and it may be in an emergency situation or a rare situation feasible to get the substitute vaccine one for the other. However, that's not what has been advised to do on the vast majority of people because it's really not been studied whether or not that would be effective. Theoretically, my personal opinion is, I think in all likelihood that would be okay, but we don't really have any science or data to suggest that that's an actually effective way of getting vaccinated. So the best thing far and away for everybody is to get the same vaccine the second time as you did the first time.
Great, and it's my understanding, and Dr. Bresnitz, maybe you could see if this is right, that when you get your allocation from the federal government, the planning is with each allocation for a second dose of that same shot for the people that have taken the first dose.
Yes, that's correct. We know what vaccine is going where, and when they get their second doses, that's what's allocated to them as well. People also, the vaccination is recorded in the system. That's reported to our statewide registry. People should be leaving the vaccination site with a card that basically indicates what vaccine they got. There should be a lot number on there as well. And they should hold on to the card, but if they lose it, it should be tracked in the system as well. So there shouldn't be a mix-up. And as Dr. Kessler pointed out, there may be a rare instance where for whatever reason that the other dose might be from the other vaccine. The recommendation to go ahead and do that. Now that's true for these two vaccines that are authorized. These are both very similar vaccines. They're on the same technology platform. I don't know what the recommendation will be in the future with the new vaccines that's coming, which have a different technology, and I could see where they might not even recommend that at all, even in an emergency basis. But we'll have to see.
Well, thanks so much, Kelly. Do you have another question for us?
I do. Our next question comes from Florence. Florence, you're on the line to ask your question.
I'm here. It's basically the same question of where in the state of New Jersey can you get a COVID vaccine ASAP?
Thanks for the question, Florence. So we have listed, because it can sometimes vary slightly by the counties, although there are statewide options as well, but we have that information all up on our sherrill.house.gov/vaccine website. So that'll give you some information. But Dr. Bresnitz, what's the best way for people to register for a vaccine?
Well, I would say the best way to register is to register in a number of different places right now. So first of all, there's the state website, what we call the New Jersey Vaccine Scheduling Site, NJVSS. And there are over 2 million people who are already registered on that site as well. And when you go through the checklist there, it'll determine whether you're eligible currently or in the future at some point. And you should get a message about that when you're done. There are a number of points of dispensing that are actually linked into that site as well. And it's possible to actually contact those sites if there are appointment slots available. I mean, it's been very difficult. Obviously, whatever appointment slots open up, they get filled very, very quickly. But there are independent sites that are not linked into or not using the state registration site. They have their own registration system for a variety of reasons. And I know there are 11 sites that are openly active in your district, and some of them may actually have their own independent sites as well. So there is a list on our website that basically lists all the available sites throughout the states that are where people can go and try to see whether they're independently registered as well. There is some plan. I think my understanding is that ultimately there are currently 58 sites in the 4 counties that your district covers that have basically filled out all the requirements for providing vaccine, to people once we have enough vaccine to give to them. Right now, there's only 11 that are actively vaccinated. So it's the word of advice is to be patient and to keep working at it and to register as many sites as you can, and then see whether one of them will pop up with a slot. Even if they're full in the morning, somebody might cancel later in the day and it might become available. So it's a project, frankly, at this point, and it's all because we just don't have enough vaccine.
Kelly, can you talk a little bit more about some of the resources as well?
Sure. We've had a number of questions like this one about registering for the vaccine. So I can just take a minute and just talk about the resources that we have on your website, sherrill.house.gov/vaccine. We also have created for this evening a downloadable PDF resource guide that is available on the Congresswoman's social media as well as on her website. And on this guide, you'll find links to the state portal that Dr. Bresnitz just referred to, covidvaccine.nj.gov, and the New Jersey Vaccine Call Center phone number, which is 855-568-0545. You will also find links to the county sites in Essex County, Passaic County, Morris County, and Sussex County, which are the 4 counties included in NJ11. A common question that we get is whether people should register at multiple sites, and the answer is yes, as Dr. Bresnitz indicated. You should register on your state site and on your county site when it's available. And, really the county sites are a great resource for, the current status of vaccinations in your county. You should also follow the instructions of your healthcare providers to understand how they would like you to register with them. I know depending on the healthcare provider, they have different modes of registering, and different providers may be handling people in different phases. So I think just really going to their websites or talking to them and understanding their process and how you should be registered with them will also be really helpful. We also have a link on this one-page resource guide to New Jersey's centralized list of vaccine locations for eligible recipients, which is also a great resource as well, and provides links to where you should be registering. So hopefully that people will find that helpful. If anybody has difficulty downloading that resource, please feel free to call our district office as well. And finally, before I get to the next question, I just wanted to also remind people to dial *3 if you have a question, and you'll be able to speak with a member of our staff. We have a large number of questions, so unfortunately we probably won't get to everybody, but we are doing our best to get through as many as we can.
Thanks, Kelly. And again, that website is sherrill.house.gov, G-O-V as in Victor, /vaccine. Maya, did you have anything to add about Essex County specifically?
So I just want to say that as far as I stated before, Essex County does have our own website as far as the registration process is concerned. And we just ask that everyone go ahead and register on that essexcovid.org website. Our website is actually based on, your appointment is based on the location in where you live. So the site is based on your zip code. So we have 5 sites in the county. So what will happen is the site will actually be picked for you based on your zip code. Other than that, just also please be patient with us. As you know, sometimes it may take we're asking for 5 days for individuals who do register for them to go ahead and be made available and eligible for a time for an appointment. So we just appreciate everyone's patience with that. That's it. Thank you.
Thank you. Kelly, do we have more questions? It sounds like we do.
Yep, and I just wanted to follow up quickly. Thank you so much, Maya, for that information. And just a reminder that the sites for the other counties are on this one-page resource, but I can quickly give people those as well. That's helpful. For Passaic County, it is PassaiCCountyNJ.org/COVID-19. For Morris County, it is health.morriscountynj.gov/vaccination. And for Sussex, it is, you can find information on the Sussex County website, sussex.nj.us. And again, please go to our social media and website to download all of that information. Our next question is coming from Phyllis from Mendham. She is a school nurse and has a question about volunteering.
Hi there. I'm going to get my second vaccine next Tuesday, and I'm going to wait my 2 weeks to get my antibodies all up to speed, and I would like any information as to where I could volunteer so that I can administer vaccinations if that is needed.
Wow, Phyllis, that is just a great and generous question. Thank you so much. I'm going to have Maya talk a little bit about some of the volunteering opportunities, and then I know when we've been speaking about the next tranche of people getting the vaccine, teachers are, the governor said teachers are in the next tranche, and we've been talking about some of our school nurses getting engaged. So that, like I said, that was really generous and thoughtful. Maya, do you want to take this one?
Sure. I think, first of all, I'd like to, I'm just going to say when we did start our sites, the overwhelming response that we got from the community as far as volunteering has been absolutely incredible. We have everyone from stay-at-home moms to individuals to our retired doctors that are reaching out to us. So we separated our volunteer staff into pretty much three categories. Those three categories involve our medical/vaccinator volunteers. So those would be the individuals that would be responsible for the inoculation of and for actually giving the vaccine. So in those, we are employing obviously registered nurses. Also, nurses from out of state are actually coming in, and the state has done an amazing job by being able to expedite their licenses. We're also using our school nurses that are giving us their time, and then part of that medical team is also the medical monitoring. We've been very, very lucky. RWJ Barnabas Health has given us some doctors. A lot of retired doctors are actually helping us in going ahead, and we're using them for the medical monitoring portion. We then have another part of our volunteering staff, and those individuals are responsible for our registration and inputting our information into the New Jersey immunization system. And those individuals, again, are just community members who we train right on site. And then we also have a third kind of group of individuals, and those are the individuals who are both in our registration, pre-registration, and also just line runners, helping individuals go ahead and move through the process. And those individuals are college students. Those are third and fourth year medical students that are also helping us out. We also have third and fourth year nursing students, a lot of public health students, which is near and dear to my heart, coming out and helping us. We have some engineering students that are coming out, so we're definitely reutilizing the resources that we have within our communities, and everyone's been extraordinarily supportive. So just understanding that, those volunteers, for us at least, in the way that we're sorting them, is just kind of making sure that we give those individuals who are best qualified for that particular position the most that they can go ahead and give us, and that we can go ahead and make sure that they're doing the best that they can. So that's that inoculation portion, that medical staff, that medical monitoring, the registration, pre-registration, and also those line runners and those individuals who are kind of helping with the traffic flow.
Thanks so much, Maya. And then we also have, I just want to get out the link for information on the Morris County Medical Reserve Corps, and we'll get this up on our website. It might already be on the one-pager. It's health.morriscountynj.gov/public/M as in Mike, R as in Romeo, C as in Charlie. And that's Morris County. And we'll continue to put up volunteer opportunities as they become available in our counties. But again, I just want to say thanks to everyone in the community who's been so willing to be helpful. So that's been wonderful. Kelly, back to you.
Great. Our next question is from Lucy in Nutley, who has a question about Tylenol and Advil regimens. Sorry, just 1 second. I'm just bringing Lucy live now. Lucy, are you there?
Yes, I am.
Great. Thank you. Please go ahead with your question.
Pardon? You want me to repeat the question?
You can go ahead and ask your question. You're live on the line.
Yes. You want me to repeat the question?
Yes, thanks, Lucy.
Oh, yes. Is it okay to take the vaccine if I've been on a regimen of Tylenol and Advil?
Oh, good question. Dr. Kessler, would she be able to get the vaccine?
Yeah, I think that the administration of Tylenol or NSAIDs such as Advil or Motrin doesn't prevent you from getting the vaccine. The guidance has been not to take those medications before you get the vaccine to like prevent, any side effects of the vaccine, but rather if you get a side effect, like if you get some local pain at the injection site or if you get a low-grade fever, you can feel free to take the Tylenol or take the Advil afterwards if you're not feeling well. For those individuals who are taking Tylenol or Advil or other forms of ibuprofen for other medical conditions, it probably makes sense to check with your medical provider who's asked you to do that before getting the vaccine to make sure that that's okay, or if maybe you could stop taking the Tylenol or Advil for a brief period of time just prior to vaccine receipt. But just because you need to take those medications doesn't make it not possible or for you to get the vaccine, and it should not prevent you from getting the vaccine.
Thanks so much. Kelly, back to you.
Our next question is from Stacy in Rockaway, who has a question about appointments for high-risk patients.
Hi, can you hear me?
Stacy, you're on the line.
Yes, can you hear me?
I can hear you.
Thank you. So, okay, my question is, how does the system generate appointments for people? Like, for example, my father is 82, and I've had him on the government, the state list, and on all the Atlantic Health sites since January 9th. He's 82. He has congestive heart failure, chronic respiratory disease, and coronary artery disease. But those are things that I checked off because they were asked, and he hasn't gotten any response as to whether there's an appointment for him.
Thanks, Stacy. Dr. Bresnitz, can you answer that question?
Well, sure. It's clear that your dad has multiple risk factors for COVID-19 and its complications, both because of his underlying medical conditions as well as his age. So he clearly is at risk. There, unfortunately, and I've addressed this earlier, is that we just don't have enough vaccine in the state to handle everybody who basically has similar conditions like your dad. We have millions of people who are eligible, including your dad, and just not enough vaccine. And as I mentioned, the best way to approach this is to have him registered in as many sites as you can that's within reasonable driving distance, including the state site. And then, you may or may not get the contact by those sites. And the best way to approach that is to contact those vaccinating sites on a regular basis to see whether there's an appointment slot that might be open. It's unfortunate that we just don't have enough vaccine to meet the demand and the need of all the people who are at risk for COVID-19. And clearly your dad's in a very high risk category as well. But we're not, the state, and neither the state nor the points of dispensing are necessarily prioritizing within all those people who are eligible. So if you have a 65-year-old person who meets who's eligible by virtue of age, versus someone like your dad might not necessarily be prioritized in advance of that 65-year-old. Everybody everybody has their own situation, and as long as they fall into the eligible category, they basically have to try and get an appointment themselves.
Thanks, Dr. Bresnitz. And it is, and unfortunately, I mentioned my own family struggles across the country, and I know I was on the call earlier with Biden's team and hearing the same things about states everywhere. There were complaints in Texas and Florida. So it has been confusing, and that I think a lot of that is not enough vaccine and then lack of transparency on the vaccine. It's very hard to do some of the planning if you simply don't know week to week how much is coming, and it changes weekly. Mm-hmm. So I'm hoping with some of the new allocations, which are more than we've been getting, and then with the certainty over the next 3 weeks of what we'll get, and then with more, ramping up with more production, I'm hoping we can start to see some ease in the systems. But I know right now it's very, very difficult, and I share, my father has lung cancer, and so, as you can imagine, it was such a relief to hear that when he was in that Pfizer trial that he actually got the vaccine, that it wasn't the placebo, and I'm still worried about my mom. So it's been a struggle, and for those of us with older parents, it's just scary. So Stacey, I'm so sorry you're experiencing that, and hopefully we'll start to see some of this ease up a bit over the next several weeks.
Congressman, if I just might add, there are many people who might be in a similar situation who actually can't get out. They're homebound. And so we've gotten a lot of questions about, well, what if a person's homebound, not in a congregate setting? How would they get vaccinated? And that's also a problem that the state is working on. We're having some conversations with the visiting nurse associations, and to see when we do get vaccine, what kind of accommodation we can make to actually bringing the vaccine to the individual. There are some restrictions right now with the current vaccines in terms of their handling requirements. They're basically very temperature sensitive, and so they're not really amenable to going into people's homes. They come in large lots. Each of the vaccines are in multi-dose vials, and so it makes it a little bit difficult. But potentially, when we get the J&J vaccine, that might be amenable because its handling requirements are less stringent, and that might be available for homebound patients. But it's just on our radar, and if you get asked that question, then you can basically provide that information to folks.
I appreciate it because it's people are homebound, and then some people are really because even if they're not homebound per se, because they're immunocompromised, they don't want to go to the large vaccine centers. So that's great to hear that is being considered, and the state's coming up with some planning for that. So thanks for bringing that up. Kelly, we've got maybe one or two more questions left. Time for one or two more. Do you want to ask the next question?
Sure. Our next question is from Arlene.
Okay. Hi there. Could you please tell me how long are these vaccines effective for?
Sure. We'll start. Dr. Kessler, we'll start with you if you have a sense of that. And then I don't know if Dr. Bresnitz, you have a sense as well?
Yeah, that's a good question. And unfortunately, a question we don't have a really good answer for as of yet. Again, the vaccines were part of large clinical trials that were done through the spring, primarily the spring and early fall of 2020. So anyone who's received the vaccine, the earliest receipt of the vaccine is probably the spring or summer of 2020. So I don't know that we know for sure. I think we can say with some confidence that it probably is protective for many months, but it may not be an indefinite sort of lifelong immunity, and we'll learn more as time goes on.
Yeah, the only thing I would add to that, and actually, I think the unfortunately, Dr. Kessler, it's even shorter than that because the clinical trials didn't start until like sort of the late July, and the amount of data that they had available is maybe at the time that they filed with the FDA was only about 3 months. I think the important point to make is that people have to come back for that second dose. I agree, we don't really know the durability of the vaccine, how long it protects. We know that there's some protection even after the first dose. Within a couple of weeks, the limited data available for both vaccines shows that actually you get protected very quickly. But you've got to get that second booster dose in order to sort of solidify the immunologic response. And when you get that, then you're much more likely to have a durable vaccine. We've heard some people not wanting to come back for that second shot because they had a local injection site reaction, or they had a systemic reaction, fever or muscle aches, and they don't want to go through it again. But we got to urge people that you got to come back and complete the series.
Thanks so much. And I think we have time for one more question, Kelly.
Yeah, I think that's right. Our final question is going to come from Carol.
Hi, Congresswoman. I was also wondering about how the process works once you're registered and whether you need to keep checking to find an available appointment on your own, or are you going to be notified directly? And also, I've registered with the state and with the county, with Morris County. I know that Atlantic Health System has a number of centers that are open. If you have registered with the county, does that mean you're registered with all of those centers?
Thanks so much. Maya, do you want to start from the county perspective and then Dr. Bresnitz?
Sure. So just to walk everyone through again, the essexcovid.org website. So once you go onto the website, you go ahead and register. Again, your registration and the site that you are going to be eligible for is based on your zip code. So once that's done, and what happens is you go into our what we call a queue, and that then gets sorted out as the appointments start to get filled up by our call center. We do, again, ask for that 5-day window. So what happens is once you go ahead and register, you get an email stating that kind of our team is reviewing your information, and please give us 5 days to go ahead and schedule you, to give you an exact time. Once that 5 days has elapsed, we do ask that you call our call center. Once you do go ahead and get that time and that date, you're automatically registered for the second appointment at the exact same time, at the exact same location, and also exactly 28 days later. So that's the way for us. So again, we just ask that there's a little bit of patience on our end, because we do have a large amount of individuals that are trying to access the site. We just want to make sure that we have the allocated vaccine for the allocated appointments that are set for that day.
Thanks, Maya. And every state and health provider is different. Dr. Kessler, can you tell us a little bit about the Atlantic Health process that Carol was asking about?
Yeah, I think it's similar in that we have a virtual or web-based sign-up registration system, but the Atlantic Health System is following the phased approach that the state is following, and so we contact folks or register folks in the same way that the county is working on it, Morris County and Essex County and the other counties in New Jersey, as laid out by the guidance of the state. So we're doing the same thing, and we're vaccinating the same individuals that the other sites in the state are doing.
And Dr. Bresnitz, do you want to talk about the state portal?
Well, yes, I think the state portal is different. It actually is linked to a number of different points of dispensing around the state. The direct answer to the caller's question is that if you register in Essex or Morris at a separate site, you're not necessarily registered at other sites that have their own registration systems, including the states. So you do have to, for those independent points of distribution or dispensing that have their own registration systems, in order to get into the system, you do have to register separately. But I would urge folks to at the very least, register with the state, because there are a number of points of dispensing that are only going to be using the state site and not having their own registration systems.
Thank you so much. And again, all of that information is on our website, sherrill.house.gov. So that is unfortunately all the time we have. I really want to thank again our panel members, Maya Lordo, Dr. Bresnitz, Dr. Kessler. Thank you again for joining us. You've been so helpful and informative in an area that I know so many of us have a lot of anxiety over, and this has been incredibly helpful. So thank you again. I know all of you are working so hard on the issue. So to everyone, please remember to register for the vaccine. You can register if you're currently eligible, or you can pre-register if you're not currently eligible through the state portal, your county's portal, or through a healthcare provider's portal if available. You, again, can go to sherrill.house.gov, G-O-V as in Victor, /vaccine, for a list of the state and county portals, as well as a federal VA portal for veterans. If we didn't get to your question tonight, my team and I are ready to help get you an answer. You can email my office at sherrill.house.gov/contact, or you can call our offices tomorrow. Our DC office number is 202-225-5034, and our district office is 973-526-5668. My casework team has been monitoring the questions as well, and will reach out to people as needed to see how we can help. You can also follow me on Facebook for the latest updates, and I also have a newsletter that's going out multiple times a week with coronavirus information. You can sign up for that again at sherrill.house.gov. So thank you, everyone. Stay safe, stay healthy, take care, and please reach out if we can be helpful. Thank you again.
Thank you,
Thank you.
Congresswoman.
Bye-bye. Bye-bye.